And so this also helps to restore things. All right. I think that we're out of time. As a matter of fact, I know we're out of time. And I know that there's going to be far, far too many questions here. Let me look and see. Oh, wow. Okay. A lot of things have come in. So let me go ahead and open this up. And Sherry, if you want to tell people how they can raise their hand, we can always start with a raised hand. And otherwise, I'll just go ahead and jump into some of the questions that are posted.
Yeah, sure. So go to the bottom of your Zoom window, click Participants. Then you'll see that panel pop up to your right. And then at the very bottom of that panel, you see Raise Hand. If you're on mobile device, just tap your screen, then tap More, and you'll see the Raise Hand option there. And I see Sarat has a hand raised.
2 people. So let's do them both. Go ahead, Saraji.
Oh, let's see, we've invited to unmute. See if the magic happens.
Okay, perfect. Namaste.
Namaste, doctor. How are you?
Good. How are you?
I'm good.
A very good session.
Thank you.
One of the things which you said early on in the session was some of the doctors and the judgment, right? There's a recent example of, I have 2 examples. One with a patient, how they were trying to, she's a cancer patient, she's trying to use the flush.
Right. The
gallbladder.
The gallbladder. Right.
And it got blocked. And I was telling her, please go to a doctor, make sure that you have to surgically take it out. But she was talking to a herbologist, gave her a flush. It became a big mess. So an emergency situation, a cancer on top of this. So we have to be extremely careful when we do that. And the second thing is,
Thank you for adding that testimonial, because it is what we are trying to avoid. Absolutely. Right. So please continue.
And the second thing was a cancer patient, after the first CT scans and all the reports, the doctor decided that, okay, I'm going to take the stomach off. I'm going to surgically cut the stomach and connect esophagus with intestines. I said, once you remove the stomach, there is no way on the earth you will be able to have lead a normal life. You can take how many ever digestive enzymes you want, but please make sure that if they can first do the chemo, if they're not able to take out, reduce the size of the tumor, and the size of the tumor was so small, and it was not obstructing the flow of the food from stomach into intestines. And finally, they took few more alternate opinions, and it looks like it's not even inside, it's outside. So it is always good to take 1 or 2 opinions, especially when a major organ is being removed.
Yes, absolutely.
Right. So I thought I bring these 2 examples to the class.
Yeah, thank you. That's very important. And this is part of doing our clinical level self-care homework, is that when we have to talk to the doctors, make sure that we get, if there's something you don't like about it, get a second and a third opinion. And especially in a case like this, it illustrates it very well. So thank you. Excellent contribution. And I noticed that somebody is asking on the chat, what are the green stone-like things that are passed out in the gallbladder cleanse? They have a spongy feel. That's the olive oil that you drink. Okay, so that is beyond a doubt not your gallstones. Okay, so thank you, Dr. Adanki, very much. And let's see who is there a second hand that was up, or is that it?
Yes, it's Noelle.
Hi, David.
Hello.
Hi. My best friend had her gallbladder removed and about 3 years ago, and she's had from like 2 days after the surgery, she started having these horrible pains that she calls attacks that radiate out from her chest and are just debilitating. And she's having like 17 a day now, and has gone to Mayo and Johns Hopkins and just everywhere. And it's been horrible. And so you mentioned a syndrome that people sometimes get. Are these the same kind of symptoms you're hearing about? Like
It sounds like it sounds like it could be, but here I'm just going to give the name, and this is a possible diagnosis. Okay, it's possible that it's not, because I don't know.
Right.
But here is, I put it in the chat. There's a good description of it on Wikipedia. It's the post-cholecystectomy syndrome. And if you,
not seeing it in the chat.
oh, maybe I posted it to, oh, sorry, Lisa, I posted it to you privately. I don't know how I got that. So let me find everyone. Okay, there we go. Now it's posted to everybody.
Thank you.
And let me just read you the presentation. Symptoms of post-cholecystectomy syndrome include dyspepsia, nausea, vomiting, flatulence, bloating, diarrhea, persistent pain in the upper right abdomen. Okay, so it's also a type of bile acid diarrhea that can manifest. So I would say that this would be something that there's a pretty high likelihood that that's what's going on. But that is something that you'll have to talk to her GI specialist with. Okay. I hope that's helpful. Now, here's what you can suggest. Get her some slippery elm powder,
Okay.
marshmallow root powder, licorice root powder, and mix those together in equal amounts. And then tell her to take 1/4 teaspoon of that in about 1/4 cup of water, about 3 or 4 times a day before and between meals. Okay, did you get that?
Licorice root powder, slippery elm powder, marshmallow root powder, mix them in equal amounts.
Right.
Then how much, please?
1/4 teaspoon in about 1/4 cup of water, and take that 3 or 4 times a day between the meals.
Okay.
And that should have a soothing effect. Now, she can take a higher dose, but I always start with conservative dose, okay? And if this helps to alleviate the symptoms, then it is somewhat diagnostic that it is probably this post-cholecystectomy syndrome.
Okay.
Because what these 3 herbs do is they're very demulcent and soothing. They coat the mucous membrane of the intestines, and they're anti-inflammatory. And so therefore, if they help the symptoms, then it probably means that the GI tract is inflamed from the unregulated bile flow.
Okay. Thank you.
Okay, yeah, and actually what I have found, it's very interesting in this situation. First of all, it's a lot more common than I realized. And
Using like nitroglycerin is the only thing, and that has horrible other side effects.
right, exactly. Well, here's what I have found out over time with this particular condition, is it's something that definitely is aggravated by the wrong kind of herbs, and it is definitely helped by the right kind of herbs. Okay, so I have had people who have been troubled with this syndrome for a long time, and the right kind of herbs have just stopped it. So it's very responsive to the right kind of treatment. Okay.
Okay.
All right, now put her on the baby food diet also.
Okay.
You know, do that. Okay, now there's a lot of questions that are coming in here that are really big subjects, medical topics here. And I would like to answer everybody's question, but we just don't have time. But I told you, I always answer everybody's question. So what I'm going to do is these, Sherry is busy copying these from the chat over to our Word doc that we use. And I'm going to answer everything. And then it's going to be posted within a couple of days. And so I will get to that. And I'm not avoiding these right now. It's just that, well, we've run out of time. And so with this, Sherry, I'm going to ask you, do you have any last minute announcements or anything that you want to tell people before we close things out?
Give me 1 second. I just need to find my spot.
Okay.
Well, you mentioned the piece about the questions, and then you were going to talk about connecting you and contacting with you and how people can do that.
Right. Okay. Well, that's easy enough. And I'll just mention that you can contact me through Floracopia. Everybody knows that. That's how we had the course. It's where we all met, through Floracopia. And also, those of you who purchased the consultation know my consultation website. And I'll put this in the chat and make sure that it goes to everybody here. And it is crowconsultations.com. Just like it sounds, crowconsultations.com. And you can contact me there also. And somebody is saying, when is the next course starting? Well, okay, I wasn't going to say anything about it, but there is another course that is coming. And it's going to be at the Shift Network. However, we are also now back up and running for launching courses through Floracopia, and we're going to also be doing that more, but that's going to start in the first quarter. And in the meantime, we're going to be launching a course at the Shift Network that will, the opening broadcast will be on December 5. So keep an eye out for that. Class starts in the first week of January. And that course is called Tree Medicine. And it's 7 weeks, and it's all about medicines from trees. I think it's a real simple kind of folk medicine kind of approach. The reason that I'm doing it is purely personal enjoyment of celebrating the medicines that come from trees. Okay, so keep an eye out for that. And okay, looks like everybody is ready to sign up. So I guess I'll be seeing you in a few weeks then. So with that, I just want to express my appreciation again to everybody. So thank you. And take good care. Stay away from people as much as you can. Use your herbs safely. You know how to contact me. And for those of you who have appointments, I'll be talking to you personally. And again, thank you for that. Sherry, thank you for hosting us as always. And with that, I will say good night and hope to see you soon somewhere down the road talking about these things that are so important. So take good care.
Shall we open the lines and say goodbye, David?
Oh, sure, if you like. I know some people like to do that. So.
Thank you.
Bye. Thank you.
Thank you so
much.
Very nice.
Thank you, everyone.
Awesome course. Absolutely wonderful. Thank you.
Thanks.
Blessings.
Kuto waha.
He did.